When I opened the abdominal cavity of the cadaver, I noticed something unusual, an odd structure near the pelvis. I looked closer, separated the tissue, and froze, because there they were. 3 of them. 3 penises. One was external, fully developed, normal in appearance and function, but the other 2 were hidden deep inside, buried beneath layers of tissue, undeveloped yet fully anatomical structures. And I thought to myself, this man lived for 73 years. He married, had children, lived a normal sexual life and never knew. He never noticed, never complained, never went to a doctor for anything related to it. He died never realizing what was inside him. And maybe you don't know either. Maybe you have a hidden organ, a silent anomaly, something unique inside your body, something without symptoms, something invisible, just waiting there, waiting to be discovered long after you're gone. The Department of Anatomy at the University of Birmingham, October 2020. A perfectly ordinary autumn morning. When I walked into the laboratory, everything looked the same as always. The metal dissection tables shining under the fluorescent lights, the familiar antiseptic smell filling the air, the atmosphere calm and clinical. My students were already there, waiting. 20 third-year medical students, excited but slightly tense, because today they would examine the male reproductive system in full detail for the very first time. A sensitive topic, awkward for some, but medically crucial. I am Dr. Sarah Thompson, a 42-year-old professor of anatomy. I've been doing this for 12 years, and in that time I've seen thousands of cadavers. I've seen every kind of anatomical variation imaginable: an extra rib, missing digits, reversed organs, situs inversus, kidney anomalies, spinal deformities. I thought I had seen it all. But that day I would learn something important. The human body can still surprise you, especially in the places you least expect. Our cadaver was a 73-year-old man who had passed away from heart failure. No family, no close relatives. He had spent his final years in a social care home, living a quiet, solitary life. He had donated his body to science years earlier, perhaps searching for meaning, perhaps hoping to be useful after death. Whatever his reason, he now lay before us on the table, covered by a sheet cold, still silent, and we were about to explore him, uncover his secrets, layer by layer. I briefed the students about the procedure. Today would be dedicated to the urogenital system. We would begin with the kidneys, then move to the ureters, bladder, prostate, testes, and finally the penis. Every layer would be opened, every structure identified and explained. The students listened carefully, some taking notes, others simply watching with curiosity. After all, seeing something in a textbook is one thing. Seeing it in a real human body is something entirely different. We began the dissection. I picked up the scalpel, sharp stainless steel, and made a long midline incision from the umbilicus down to the pubic symphysis. The skin opened easily, revealing a thick layer of yellow subcutaneous fat beneath it, the kind of age-related adipose tissue that accumulates slowly over years. We cleared the fat, cutting and reflecting it aside until we reached the fascia, the shiny white connective tissue sheet covering the abdominal wall. I opened it carefully, then lifted the thin peritoneal membrane. And just like that, we were inside the abdominal cavity. The first organs were completely ordinary. The liver on the right, large and slightly fatty but normal in size, the stomach in the center, the loops of intestine neatly arranged in their usual positions. Everything looked anatomically textbook perfect. My students leaned closer, many of them seeing real human organs for the very first time. Some took photos with trembling hands, a mixture of fascination and nervous excitement clear on their faces. We moved on to the kidneys, situated in the retroperitoneal space along the posterior abdominal wall. They were exactly where they should be, the right one slightly lower because of the liver above it, the left one positioned higher, as expected. Both measured roughly 11 centimeters, with a bit of age-related atrophy, but nothing unusual. Next, we explored the bladder, sitting behind the pubic bone, distended with urine that had collected after death. Beneath it was the prostate, noticeably enlarged, probably 50 to 60 grams, a classic case of benign prostatic hyperplasia, extremely common in older men and usually responsible for urinary difficulties. Then came the pelvis, the most intricate and crowded region of the body. Bones, vessels, nerves, organs, all packed together in a tight space that requires slow, deliberate dissection. I carefully separated the pelvic fascia, lifting each thin membrane and exposing the structures beneath layer by layer. As I approached the root of the penis, just behind the pubic symphysis, something caught my eye. On the left side, barely visible at first, there was a small bulge, a subtle prominence, something that absolutely should not have been there. I touched the small bulge with my fingertip, applying gentle pressure, and immediately felt that it was firm, very firm, almost like bone. I considered the possibility of calcification. In elderly patients, tissues can harden or mineralize, but the location was strange. There shouldn't be any calcified structure in that region, so I picked up my scalpel and decided to open the area to see what was inside. I separated the tissue slowly, layer by layer, carefully peeling back the fascia, and then something appeared. A pink structure, soft tissue, yet oddly familiar in shape. I exposed a bit more, clearing the surrounding tissue, and then it fully emerged, unmistakably, and my breath caught in my throat, because what I was looking at was a penis. A small one, yes, but a complete, anatomically accurate penis. The glans was visible, perfectly formed, the shaft present with its typical cylindrical shape, and even the foreskin remained intact, lightly folded over the tip. One of my students gasped and asked, "Professor, what did you find?" I raised my hand and said, "Just a moment, I need to examine this more carefully." I pressed gently against the structure, feeling the spongy resilience of the corpus cavernosum, the erectile tissue unmistakable beneath my gloved fingers. And all doubt vanished. It was a penis, about 4 centimeters long, underdeveloped but fully formed in every anatomical sense. My pulse quickened, a sheen of sweat forming across my forehead, because I realized how extraordinary this discovery was. This was not normal. This wasn't even rare. This was nearly unheard of. I knew of triphallia, the condition where a person is born with 2 penises, an anomaly seen in roughly 1 in 5 to 6 million births. But 3 penises, triphallia, had only ever been documented once worldwide, in a newborn. There had never been an adult case reported, and yet here it was, right in front of me, beneath my hands. I immediately wondered whether the left side was an isolated duplication, or whether the right side might also hide an additional structure. If there was symmetry, I needed to confirm it. So I examined the corresponding area on the right, at the base of the penis, and there it was again. A small protrusion beneath the tissue, just like the one on the left. My excitement grew, tempered with intense focus, and I began dissecting the area with the same meticulous care, revealing what I suspected might be yet another fully formed organ. Moved through the tissue layers on the right side, separating the fascia carefully. And there it was, the third penis. Smaller, about 3 centimeters, less developed and almost rudimentary, but still unmistakably a penis. It had a recognizable glans, a small shaft, soft pink tissue, and in that exact moment I realized that this man had lived his entire life with 3 penises, had been born with 3 penises and never knew it. The laboratory fell silent. My students had gathered closer around the table, all staring in disbelief. No one spoke. They simply watched, frozen in a mixture of shock and fascination. I stood there staring as well, looking at all 3 structures. One external and completely normal, about 8 centimeters in length, uncircumcised with an intact foreskin, and 2 others hidden deep inside the pelvis, small, underdeveloped, yet anatomically complete, with corpus cavernosum, a glans, skin folds, everything just miniature and concealed. One student finally broke the silence and asked, "How is this possible? How can there be 3? I told them I didn't know for certain yet, but it had to be an embryological anomaly. Something must have gone wrong during development, a division of the genital tubercle early in fetal growth, causing it to split into 3 separate penile structures. Only one completed its development. The other 2 halted early and remained hidden internally. I began thinking about this man's life. He lived for 73 years. The medical records indicated he had been married, had 3 children, led a seemingly normal life. His external penis functioned normally. He could have erections, ejaculation, intercourse, father children, and he never knew about the other 2. Perhaps he occasionally felt pressure or unusual sensations in his pelvis, but he must have attributed it to age, discomfort, or something benign. He never sought help. He never suspected anything. I immediately reached for my professional camera from my office, knowing that what we had found was historic. I photographed everything from multiple angles, the arrangement of all 3 penises, the spatial relationships, their attachment points, and then close-ups to document every detail, the tissue texture, color variations, vascular structures, because I knew this would belong in medical literature, in textbooks, in journals. Then I recorded precise measurements. The primary penis measured 8 centimeters in length, 2 centimeters in diameter, fully functional with clear neurovascular supply. The second measured 4 centimeters with a 1 centimeter diameter, showing some erectile tissue but limited vascularity. The third measured 3 centimeters with just half a centimeter in diameter, the smallest nearly vestigial, but still anatomically identifiable. I collected tissue samples from all 3, tiny biopsies for histological examination. I wanted to study their cellular structure under a microscope, the organization of corpus cavernosum, the density of blood vessels, the nerve bundles, everything. My students remained silent, watching intently. They knew they were witnessing something extraordinary, a moment that would be recorded as part of medical history, and they were its first witnesses. I finished the lesson, dismissed the students, closed the lab, and rushed straight to my office. I turned on my computer and immediately began a literature search, because I needed to know whether this had ever been documented before, how many cases existed, and how such an anomaly was explained. I typed in terms like triphallia, 3 penises, triple penile malformation, and the search results appeared. Only a handful, barely anything. One case report came up from March 2020, published by a team in Iraq. It described a 3-month-old infant who was born with 3 external penises. Surgeons removed 2 and left 1 functional. Aside from that, there were no other cases. None. No adult cases, no hidden or internal triphallia, nothing resembling what I had just discovered. Just that single infant. I opened my embryology textbooks next, reviewing the stages of penile development. Around the 4th week of gestation, the genital tubercle forms, a small protrusion in the pelvic region of the embryo. Under normal circumstances, this structure elongates, differentiates, and eventually becomes a single penis. By the 9th week, exposure to testosterone begins the process of masculinization, and by the 12th week, the penis is fully formed, ready at birth as a functional organ. But in this case, something different happened. Something caused the genital tubercle to divide into 3 separate segments, initiating the development of 3 penises instead of 1. And the truth is that we still don't know why. There is no definitive explanation. There are only theories. Some hypothesize a genetic mutation, possibly involving the Hox genes that control the body's structural layout. Others propose a hormonal issue in the womb, an imbalance, a timing error, excessive androgen exposure. Environmental factors have also been suggested, such as chemical exposure, medications taken during pregnancy, or radiation. No one knows for certain. There is no solid answer. I found the hospital records, obtained ethical clearance, and since the man had passed away with no surviving family, the archives were fully accessible. I read through everything. He was born in 1947 in Birmingham, England, delivered at home with the help of a midwife, not in a hospital. There were no notes about abnormalities at birth, which means the external penis appeared completely normal and the two internal ones went unnoticed. The midwife would have only examined what was visible. One external penis, male infant, normal. His childhood records showed routine vaccinations, common illnesses like measles and throat infections, nothing unusual, and no documentation of any genital or urinary complaints. He never reported pain. His parents never took him to a doctor for anything related to his reproductive system, so clearly the hidden structures never caused symptoms. During puberty, around age 13, his records described a typical progression: voice deepening, facial hair growth, increased height, all normal endocrine development. His sexual maturation must have been normal as well. He could get erections, he could masturbate. Everything functioned as expected because his external penis was fully developed and operational. In adulthood, he married at 25 to a woman named Margaret, a factory worker, and together they had 3 children, 2 boys and 1 girl. This confirmed that his sexual life was active, consistent, functional, and fertile. His wife never suspected a thing. She only ever encountered the normal external penis. The other 2 remained hidden, impossible to feel from the outside, buried deep behind the pelvic bone, silent and unknown throughout his entire life. In middle age, around 40, he developed benign prostatic hyperplasia, experiencing difficulty urinating, frequent bathroom visits, and nighttime awakenings. But he received medication and improved. I am not certain whether any physician ever performed a digital rectal exam on him. His records don't specify, but even if they had, the hidden penises would never have been detected. They sat too far laterally, tucked deep against the pelvic wall, well outside the reach of a finger during a standard prostate examination. In his later years, he retired at 60, lost his wife to a heart attack at 70, and eventually moved into a social care facility, living quietly and alone. At the age of 73, he passed away from heart failure, a peaceful, painless death, completely unaware that he had lived his entire life with 3 penises, never knowing his body carried an anatomical rarity, unlike anything seen in modern medical history. I contacted colleagues across the world, urologists, embryology specialists, anatomy professors. I sent emails, attached photographs, asked for their interpretations, and soon replies began arriving. Shocked messages, disbelief, questions of authenticity. I provided more images, more evidence, histology slides, microscopic tissue examinations, and finally the consensus emerged. Yes, it was real. Yes, it was true triphallia. Yes, the first documented adult case, and yes, a historical discovery. I wrote the case report quickly, detailed yet concise, titled Triphallia in a 73-year-old man, the first adult case. I included photographs, added the histology results, and submitted it to the British Journal of Urology, a highly respected journal. 3 months later, it was accepted. The reviewers were stunned, writing comments like, incredible, unique, and must be published. It was published in December 2020, and it exploded. Social media erupted with reactions. The BBC called, CNN called, the Daily Mail ran a front-page headline, "Man dies not knowing he had 3 penises." The Guardian covered it, the New York Times covered it, and my photographs circulated everywhere. Censored, of course, but still unmistakably showing all 3 penises. Reddit went wild. Thousands of comments poured in. How did he not know? Could I have one and not know? Is this even possible? I answered questions, hosted and spent 2 hours replying to hundreds of messages from shocked readers, and overnight I became internationally known, the discoverer of the adult triphallia case. Birmingham University celebrated it, the story spread across medical circles, and we officially entered medical history. I presented the case at conferences, explaining that during the 4th week of embryonic development, the genital tubercle forms as a single protrusion that normally develops into one penis, but in this patient, it appeared to have split into 3. It could have been a genetic mutation, an error in the Hox genes, exposure to endocrine-disrupting chemicals, or medications used by the mother. There is no definitive answer. There was no family available for history, and no genetic testing could be performed. So all we have are hypotheses. The external penis was fully functional. He married, had children, and lived a completely normal sexual life. The other 2 were non-functional. They had no urethral opening, just tissue, essentially vestigial structures. Theoretically, they might have had the potential for weak erectile filling, but in reality they never functioned because the nerve supply was minimal and the blood flow extremely limited. Remarkably, no complications ever occurred. No infections, no pain, no tumors. Those 2 hidden penises simply existed passively inside him for 73 years, unnoticed, undisturbed, and completely unknown to the man himself. 4 years have passed since that discovery, and I still find myself thinking about that man. He lived 73 years, lived an ordinary life, and never knew he was extraordinary, never knew he was unique. He died quietly, without ever realizing what he carried, and then I found it, I uncovered it, and I brought it to the world. The cadaver is still at the university, preserved in the special collection, suspended in formaldehyde. The pelvis has been specially prepared. The 3 penises are clearly visible. Students come in, they see it, they stare in disbelief. They take photographs, and now it appears in textbooks labeled Triphallia Birmingham Case 2020, illustrated with my images, my name beside them. I feel proud to have contributed, proud to have added something meaningful to science. Has another case ever been found? No, not yet. Only this one, only a single adult case of triphallia. But I'm certain there are more. Somewhere in the world, perhaps 10 people, perhaps 20, perhaps 100 are living with the same hidden anomaly, carrying an organ they will never know about. They will live and die without ever discovering it, because it causes no symptoms, no pain, no complications. It simply stays there, silent and unseen.